The Ebola outbreak continues to escalate as the death toll climbs in Congo, and there are new infections in Uganda. Red Cross workers are going door to door sharing information about the disease, how it spreads, as suspected cases are now topping 900. The chief of the World Health Organization has issued a stark warning saying at the moment, quote, "The epidemic is outpacing us." So joining us to talk about the developments in the outbreak and vaccines is 9 News medical expert Dr. Payal Kohli.
Welcome. I think it's just a fair question to start with. Do these vaccines exist in the marketplace?
So they do,
They're out
ladies. Yeah. So Ebola is a family of viruses, and there's actually 6 viruses. 4 infect humans. Only 1 has a vaccine, and that's not the one in the DRC right now. So we really have to work to try to make a vaccine because that's not the one that's on the market.
So the existing Ebola vaccines cannot help with this specific strain. So is there anything in the process?
Yeah, so you just asked a $1 million question. We don't have a lot of research telling us whether the existing vaccines will cross-cover this other strain, but based on what we know from primates, chimpanzees, animal models, we don't think it's effective. So the Zaire strain is the one that we do have the vaccine against. The BDV strain is the one down in the DRC. We don't think there's coverage. So they're working on looking at more studies to try to see if we can use these existing vaccines, but actually what we really need is that vaccine development.
Well, and let me ask you, maybe this is a silly question, but like, is that fairly easy to do? Can you just create a vaccine, right? I mean, we did it fairly quickly during COVID, right?
So that's exactly what they're doing, Alex. They're taking the same vector, the same virus that they used during COVID. So there's 2 vaccine sort of candidates that they have right now that they're studying. And the first one is being studied at University of Texas. And that's the one that's taking the Zaire vector and basically swapping it out and putting in the BDV DNA. So they're essentially using the same tool that carries it into your body, but then switching the information to try to see if that works. So that would be easier because it's already been validated in the Ebola strain. The second vaccine candidate is coming out of the UK, and they're getting a lot of support from New Delhi for manufacturing. This one's like the COVID vaccine. So using some of that same technology, but using a different viral vector. Now you guys can imagine some of the challenges with studying this particular vaccine when we know that this disease requires a lot of biosafety. It's a huge biohazard. You can't study it in rats or those types of models. It really has to be non-human primates. So it's a very expensive disease to study. So chimpanzees, monkeys, that's who we'd have to study it in. And you're talking about a disease that doesn't behave like the flu, where it comes back every single year. These sporadic, random outbreaks that move so quickly. So even being able to study whether or not it's effective in humans, it's a huge challenge.
Wow.
So in a perfect world, if we're developing these candidates or a vaccine, what is the timetable here, and what happens to the people that are currently suffering?
So 6 to 9 months to get this vaccine to testing, and then you're talking about essentially trying to contain the current outbreak. So I really think for this particular current outbreak, it's almost too little too late. Like we're behind. And as they said, the WHO is saying this is getting out of hand. It's sort of getting away from us. But what we would do, if let's say magically we happened to get a vaccine and the outbreak was still going, because we expect it to go for several months, we would have a strategy of what's called ring vaccination. So you know how with COVID we said everybody go out there and get vaccinated, right? Because your risk of exposure is high and the virus is everywhere. Here you only vaccinate the ring that's exposed to the virus. So it's of course the people, the family members, the caretakers, the Red Cross workers, all of those, and that hopefully can contain it. But one of the things about this virus I really want to emphasize, in the past we've contained outbreaks without a vaccine. So I think there's hope. There's hope that we can do it, even though the vaccine development seems to be far down the line at this point.
Okay, we'll have to hold on to hope, as they say. Dr. Kohli, thank you for the latest on this.